Hi everyone, welcome back to the Australian Rotary Health podcast called The Research Behind Lift the Lid. I'm Jessica Cooper, and on our 31st episode, we will be having a chat with Dr Clare McCormack. Australian Rotary Health awarded Clare with an Ian Scott PhD scholarship from 2013 to 2015 to conduct research on the impacts of prenatal alcohol and drug exposure on infant cognitive development at the University of New South Wales National Drug and Alcohol Research Centre. Clare is now a Robert Burt Presidential Scholar in Society and Neuroscience at Columbia University in New York. Her research focuses on psychological health in pregnancy and the peripartum, and how these experiences are affected by maternal stress and trauma. So thank you so much for joining me on our podcast today, Clare. I'm sure a lot has happened since completing your PhD. So what have you been up to since then?
Yeah, thank you, Jessica. Great to be here. So since I finished my PhD, I guess the main thing is that I moved to New York City. I got in touch with a lab at Columbia University, the Perinatal Pathways Lab, which is led by Dr. Catherine Monk. And I was lucky enough to be offered a postdoctoral fellowship there. So I guess moving on from my PhD research, which was focused on drug and alcohol use in pregnancy, I became aware of the need to consider the bigger picture if you want to understand how development begins before birth. So drug and alcohol is one thing, but it turns out depression, stress, and trauma can also be exposures that affect the fetus on their own. And this is the focus of the lab that I moved into. It was meant to be a 2-year experience, but once I was there, I became very interested in this area, realized there's a lot of really exciting science going on, and I wanted to continue my research. So I drew a few threads together. I designed an interdisciplinary program of study looking at how pregnancy and the transition to motherhood might be shaped by maternal stress and maternal history, and also effects on the offspring, so intergenerational trauma. So there's fascinating neuroscience around this topic I was excited to get into, but really to address those questions properly, you need multiple disciplinary approaches working together. So this ultimately led me to being fortunate enough to be I'm one of Columbia's Presidential Scholars in Society and Neuroscience, where I work with great mentors from diverse fields across neurosciences, psychology, humanities, to answer some of these big questions.
Yeah, well, that sounds like a very exciting opportunity, being able to, take your career to the other side of the world. So yeah, that must be really good. And I can hear that you're very interested in what you're doing now as well. So yeah, that's really great. I suppose many of us know to avoid drinking alcohol during pregnancy. I guess, taking it back to that PhD research that you did, looking at the alcohol use in pregnancy. I guess in particular, you were sort of looking at the alcohol use in early pregnancy, so when someone might not even know that they're pregnant. I guess, can you tell us why this particular area was important to investigate at the time?
Yeah, well, the simple reason really is just that we thought probably, at least anecdotally and just from logic, that would be when most alcohol exposure probably occurred. But interestingly, looking at literature, hardly anyone had actually collected data to really figure this out, whether this was the case and what the effects of exposure at that time might be on cognitive development in kids. Also, I think that period is a really different period and important to study separately from the rest of pregnancy, because, alcohol use is a behavior. And it's quite a different behavior to someone who's continuing to drink all throughout their pregnancy. To lump all drinkers into one group would be kind of misleading when many of them have actually stopped drinking extremely early. Often people find out they're pregnant within the first, 4 to 6 weeks.
Yeah, that's very interesting, because I suppose, many people who are, trying to get pregnant, they wouldn't necessarily want to drink during that. So yeah, not putting them in that same category as, sort of people who, don't mind having a drink while pregnant. Yeah, I think that would probably be very important. Yeah.
Yeah, and most people stop when they find out they're pregnant.
Yeah. Okay. So I guess as well, when you started your PhD, what sort of questions were you hoping to answer, and how did you go about answering them?
Yeah, so I wanted to understand whether alcohol use in pregnancy, specifically in particular levels of alcohol use, might affect infant cognitive development, taking into account as many social and environmental factors as well as was possible. And that's quite an undertaking. So to do this well, there are lots of things that you need to make a study strong. And I was just a student. So I, of course, was part of a bigger group, working as part of a large NHMRC funded longitudinal study at the National Drug and Alcohol Research Centre, led by Richard Maddock and Delise Hutchinson. And this study really met all the criteria that you need to pull off, addressing a research question like this. So you need a prospective and longitudinal study where you've started with people in their pregnancy and followed them up over a long period of time. You also need a big sample to be able to find. It might not be big effects, there might be subtle effects. You also need a huge amount of data on a huge range of factors in the family, everything from demographics, physical and psychological health in parents, birth outcomes and development in the kids. And then in terms of outcomes, you need observer-rated assessments of infant development. So using a rigorous test battery, this is the most, reliable and gold standard way of measuring kid development. So this study that I was able to be part of did all of these things and met that gold standard criteria. So I also worked with great people at NDARC to achieve this.
Yeah, well, it certainly sounds like a really strong study, in terms of how much data you had and, that big sample. So yeah, it sounds like it would have been, very important and very valid as well. Yeah. So I guess, as well, because it was such a big study, did this receive any media coverage or, be published in any, notable journals?
Yeah, there was a bit of media coverage in Australia. And I published 3 journal articles on the results. And most recently, I've kept up my interest in this area. Most recently, I wrote an editorial for the American Journal of Psychiatry, where I looked at findings of studies like this, trying to make sense of them alongside research from the broader developmental origins of health and disease fields, taking into account factors like parents' mental health, as well as social determinants of health, like poverty and neighbourhood safety, things like that.
Yeah, that sounds like it was very interesting, and it's good to hear that some big results kind of came out of that. Could you maybe talk us through what some of the key findings were from this study?
Yeah, so I guess, in terms of take-home messages, I guess some people would be reassured to know that we actually did not see evidence that alcohol use during pregnancy, particularly at low levels, and including alcohol use in that early period prior to pregnancy awareness, we didn't see that it was associated with any impairment in cognitive development in kids at 1 year of age. People who may be worried if they, found out they were pregnant, but may have drunk some alcohol, inadvertently, or be worried about a bit of alcohol use. Of course, there are some caveats. So firstly, that there weren't as many women in this sample drinking very heavily. So we had the most ability to talk about low level drinking. And also this is one specific outcome at one time point. So there might be other ways that offspring can be affected that we didn't measure. And also this sample tended to be women who were relatively well off and healthy. So there might be other risk factors that make kids more vulnerable.
Yeah. It sounds like those were some very interesting findings. Would you say that this would have some implications in terms of, helping real people?
Yeah, I mean, I think my take-home message, not just from this study, but also in the context of other studies in this area and in perinatal mental health, because I was quite struck by these findings, is really that I think supporting women during this period is the most important thing we can do. So for some, this may in fact involve support around alcohol and substance use. It's not always possible for someone to suddenly stop drinking or using a substance so easily. So you want to make sure that it's possible to find help without that shame or stigma. And whether you're worried about mum or worried about the baby, I think centering the women's mental health needs front and center really has the potential for the greatest impact, not just on women, but also the next generation.
Yeah, definitely. Well, it sounds like these findings, can really help in informing, ways to support women. So that sounds like it, would have some really positive impacts there. I guess as well, you said that you were working with other researchers at the National Drug and Research Centre, and it was part of a large trial. Has this research led to any other important research discoveries in that same area?
So the papers published so far have been cited quite a lot, actually. So it seems like it has been valuable evidence helping to draw attention to the fact, for instance, that a lot of alcohol use happens before people know they're pregnant, that this has public health implications. And that study is actually ongoing. It's now mostly being run by Dr. Delise Hutchinson, who's at Deakin University, and the kids are being followed up, I think, up until the age of 8, if I'm not mistaken. So I think it's, these longitudinal studies, the longer we can follow up kids, the more we learn.
Yeah, definitely. Okay, well, it's really great to hear that. And I know as well, you would probably know our research is primarily funded by donations and fundraising efforts of Rotarians. I understand that infant mental health may be an area that requires a lot more research, and there's so much more that could be done. Could you explain to our Rotary audience why continuing to donate to this area might be important?
Oh, well, mental health in general, we all know, is one of the biggest health challenges facing Australia and the world, especially in the current moment. I think everyone is very concerned that mental health needs are only going to grow, in the coming months and years ahead. I live in New York. I know I've seen firsthand how, the immense impact this pandemic is having on mental health. So, but in terms of infant mental health specifically, I think a lot of science is telling us how absolutely critical the perinatal period, so during pregnancy and the first 100 days of infant's life, how important they are in terms of shaping risk for mental disorders throughout life. So this may sound alarming, but really what it is a window of opportunity. By doing everything to understand optimal development of infants in these early months, even before birth, we could be designing interventions that reduce the risk of mental illness ever appearing later. So better help for pregnant women might be the best place to start.
Yeah, absolutely. Yeah, we strongly believe that, prevention is a lot more helpful than, than treatment necessarily. Yeah, so we really focus our research on prevention and early intervention. So yeah, I guess getting in really early at those initial stages of development, that would be really important, I think. Yeah, so I know as well that, some of the funding from Australian Rotary Health does help early career researchers kind of kick off their research. And I guess that might have been the same for you, starting your PhD. I guess, could you maybe talk us through how helpful it was to receive that initial funding from Australian Rotary Health?
Yeah, it was incredibly important. I think Rotary are really unique and pioneering by specifically supporting mental health and also by supporting early career scientists. It's so important. It definitely has a long-term impact on the field by building up the next generation of researchers, but also I think you're tending to support more innovative and new ideas. And for me, I think it was incredibly valuable to receive that encouragement so early on. That my own ideas and my own work were actually important and could make a difference. As a scientist, you need to figure out how to carve out your own space, and Rotary helped me do that.
Yeah. Oh, well, that's really great to hear, and it's great also to hear, how far you've come since then. Working in New York now, and it sounds like you've had a great career so far.
Yeah, I'm so grateful. It really means a lot.
Yeah. Well, thank you so much for joining me on our podcast today, Claire. It's been really great to talk to you about your research. I guess before we wrap up today, was there anything else that you'd like to add?
No, I just, again, want to express my gratitude, and I'm really excited to follow, the studies that Rotary is funding now, and will, I'm sure, to continue to fund. Yeah, keep up the great work.
You too. Well, thanks again, Claire. That was the 31st episode of our podcast called The Research Behind Lift the Lid. It's always so inspiring to hear what researchers in Australia are doing to make a difference to mental health, and how they are helping us on our mission to lift the lid on mental illness. If you can, please support important mental health research like Claire's by donating on the Australian Rotary Health website. Thank you for listening. Please join us again next time.